Hello, my name is Stephanie Wise, and I am an athletic trainer and adjunct instructor at Middle Tennessee State University. Today, I will be demonstrating how to perform the Upper Limb Neurodynamic Test 1, which is a bias to the median nerve. This test is useful if the clinician suspects a neural injury by determining the presence of peripheral neuropathic pain in the upper extremity. It can be useful for certain conditions such as cervical radiculopathy, pronator teres syndrome, or carpal tunnel syndrome. The median nerve arises from the lateral and medial cords of the brachial plexus. It descends down the arm anteriorly to the elbow and forearm, then passing through the carpal tunnel of the wrist. So to begin this test, you're going to have the patient lay supine on the table with their upper extremity at the end of the table. You want to make sure that you are asking the patient what their symptoms are, so you have a comparison when you're going throughout this test. So what you're first going to do is you're going to take your hand that's closest to the patient and you're going to create a block for their shoulder so you're not having that elevation of that shoulder. So you're going to block that elevation of the shoulder. You're going to abduct then your shoulder to anywhere from 90 to 100 degrees of shoulder abduction. Then you're going to get them in full external rotation. You okay there? Okay. It's important that you do go to in range for this. From that point, you're going to extend the elbow and fully supinate their forearm. From there, I'm going to remove my hand from up here because now I have leverage. If they start to elevate their shoulder up here, I can then apply a little bit of traction and prevent that elevation. So full supination and elbow extension. I'm then going to extend their wrist and relax your hand for me. Extend their wrist, thumb, and fingers, and I want to make sure that they're not flexing their DIPs, and so I want to bring them into full extension. How's that feel? Okay. Okay. If you need additional sensitizing maneuvers, what you can have them do is once you're in this position, you can then have them fully laterally flex their head to the opposite side. If that increases some of their symptoms, have them bring your head back to a neutral position. And if they have a reduction in symptoms, that's also going to be indicative of a positive test. So there's three ways that these tests can be positive. The first one is it reproduces those same symptoms that they were complaining of. If number two, they have new sensory responses to that particular test. Or the third one is even if they don't have a sensory response, but you feel as a clinician, there's more resistance in that tissue as compared to the other side.